Okay, so I have verified my orders. I have an order for one packed blood cell for Foley Fernan. I have my signed consent right here. Okay, right there. Okay. I have also pre-medicated as needed. I'm going to now gather my equipment, walk in, close the door behind me. I'm going to phone up. Hi, my name is Terry. I'm gonna be your RN today. Can I get your name and date of birth? I'm checking the name and date of birth. Yes, that matches my record. Okay, so we're going to give you 1 unit, a pack of red blood cells. This will take approximately 4 hours, maybe a little less. So I am going to need your cooperation here. If you notice any signs of just general malaise, so if you're feeling bad and pain, especially in the back, any trouble to breathe, itchiness, rashes, hives, please let us know so that way we can stop the infusion because you might be having an allergic reaction. Okay, so now that I've done that, I'm going to assess his cardiopulmonary, so I'm going to go to his heart and lungs and listen to. I'm going to assess his level of consciousness and his neurological status and also his urinary output to see how much he's urinating. And if it's good, we don't want to damage that from the hemolysis. Okay, and also while I'm here, I'm going to assess his IV site. It needs to be at least a 20 gauge, if not larger, which he does, and it's also a central line. Okay, now that I have that, I'm now going to spike my normal saline. I'm first going to don gloves. I know we don't have to on the checkoff. It just seems like a smart idea. I swear we did it beforehand, but I got plenty of time. I'm wearing gloves. Pay for it with my college tuition. Okay, get my blood administration kit. Need to figure out which side it's on. If not, it might be on top or the bottom. Not on one of these. Hang on. Up here. Yeah, there it is. I see you, buddy. Okay. Popped it open. Over there. Okay. God, this table's small. I'm just going to rip it open now. Doesn't matter. As long as everything pops off, we're all good. I'll pick that up later. Okay, so I'm going to take my two teeth and this, let everything untangle. I'm now going to lock everything, as that's what is expected of us. Now that everything is locked, okay, I am now going to take one of my teeth up here, take my bag, it seems to be clear, no, not expired, no particles are floating, open it up, and then also open this one up, without touching either hub, and remaining aseptic, insert my tubing down to the hub. I can now tilt that over and hang up. Hey, you can just see the lines. Ain't that perfect? Okay, so I'm going to hang the tip over here while I set everything else up. I am now going to unclamp this top roller, do the normal saline, and fill up my filter with normal saline just above the filter, so that way blood doesn't clot in the filter when we introduce blood. Okay, we have that. So now, not to pull a friend, I am now going to prime my line, and I will make sure all air bubbles come out. So it is nice and slowly up until it's all the way primed. God, this is a long line. Okay, I'm fine. Okay, I'm gonna lock it back up and hang it back up for a second. Okay, I am now going to take a flush and I'm going to an alcohol pad. Wow! Open my alcohol pad. Okay, I'm going to take my port. I'm going to cleanse my port. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Insert my flush. In one swift motion, aspirate. I got blood return, and then I'm going to pulse 5, 10 mils. Since it's a central line, I need at least a 10 millimeter syringe. Okay. Now that I've pulsated, I'm going to detach without locking it. I'm then going to take another alcohol pad. And swab again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, I'm now going to take my tubing. Without dropping this, I'm going to open up my tubing and insert and twist. Okay. Now I'm going to open it up to a keep vein open status, which is about 20 milliliters, while assessing for infiltration. Okay, and while that is happening, I'm going to remove my gloves, foam out, and make sure my patient is in safety and comfortable. So bed, low lock, call light within reach, personal items within reach, while I run and grab my blood in another nurse. So real fast, I'm going to flash. Okay, I have my paper here, and I'm going to check it with another nurse against this and this. So I'm going to look at it, my patient name and date of birth. Yes, those match, and he has told me his name and date of birth. His medical record number matches here and here. Okay, cool. We're also doing the unit number on here, which matches with his blood bank ID, which we're also going to be checking since he has one. We're checking the expiration of the blood, which is good. We're checking the cross-match compatibility, which is good. We're also checking the compatibility of the blood types, because guess what? That matters. And he has his wristband chart. Okay, we're good here. I'm going to have another nurse sign off on that. Wow, we did it. There and there. Okay. Vital signs. We're grabbing a set of vital signs real quick. Temp, heart rate, blood pressure, respiration rate. Okay. Now that we've done that, I should have took my blood pressure pill this morning. Now that we've done that, we are going to spike our bag. I'm now going to apply some gloves. I would have foamed up before putting on gloves, so I mean, I foamed up with walking in here to check it with the nurse and all that. Foam. Foam before you touch a patient, foam before this, foam before that, foam. Okay. I'm going to now relock all my roller clamps, including the one with normal saline. I am now going to aseptically remove everything and okay, there we go. Took that off. This is locked. I'm going to remove it now and just stick it in there in one swift motion. Okay, now we're going to just simply hang it up. Okay, now that we've hung it up, I am now going to, and the lower one's locked, the upper one is locked. I'm going to unlock the blood one now. And after we do that, we're going to squeeze a bit of blood in here up until that main line is full of blood. There's no air bubbles in the main upper line. There's just a little bit more to really saturate that filter. Okay. It's filled with blood. Okay. Now that it's filled with blood, we're going to set our pump. We're going to unlock this lower roller and we're going to set our pump to 50 to 75, a low rate, while we also are now, once the blood hits the vein, we are going to be assessing our patient every 5 minutes for the first 15 minutes, and then we're going to be assessing him for the following, for the next hour, so 3 more times every 15 minutes, and then every 30 minutes until all the blood is gone. While we're assessing our patient in our vital signs, that's what we're, every 15 minutes, all that 15 minutes, 5 minutes, and every 30 minutes, we're taking our vital signs. We're assessing them as well during that time for any adverse reactions like dyspnea, rashes, highs, flank pain, fever, chill, etc. Okay. Okay. I'm going to foam out, move my gloves, patient set, shaky, bed low locked, cola within reach, personal items within reach. Cool. So now that we have done everything like that, we are going to come back in while the fluid is done. And so whenever that happens, so all the blood has ran out, we are going to lock our blood, and then we will resume with normal saline and let that run until all the blood has been administered. Once all the blood has been administered, we will be going through our vital signs again, neurological assessment, which is level of consciousness. We'd also run through our cardiopulmonary assessment, and urinary status. Okay, now that we've done that, we are prepared to discontinue our blood product after it is all ran through with the normal saline, which we also jot down on our paper and document. We'd also document our normal vital signs, or our baseline vital signs. Basically, every time we took a vital sign, we'd be documenting it because it's kind of our job. Okay, so in every assessment, we would document our job. But okay, now that we have finally administered all our blood, we've done our assessments and our vital signs yet again. At the end of it, we are going to discontinue our thing, our blood, our tubing. So now we're going to disconnect our line. This one has been a problem all day. Okay, there we go. We'd lock that and send that back up to blood lab or blood bank, or as policy recommends. Okay, so I don't think it says to. No, it says to do this time. I'm going to alcohol swab 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and then we're going to follow it up with a normal saline flush. We don't need to aspirate because guess what? There's blood in the line. It's going to be blood. It's going to be blood. So we would pulsate 5 to 10 mils. Cool. Now it says not to. It says not to. I don't know why. I would personally, because it's never a bad thing to alcohol swab again. But we're going to follow that up with since it's a central line, we're going to follow up with a heparin flush, which 100 units per mil, and just flush it out. And then we'd lock it. So now that we have locked it, we're going to remove our heparin flush. We have a heparin lock, we'll tape it. Okay, and then we would do all of our documentation, of course. We would then assess for, we wouldn't have to assess him one final time. We need to put him in low lot, side rails up, call out within reach, patient safety, what we do with every patient, personal items. So once we do that, we send that all off to the lab, or not lab, but blood bank. We would also document all of our findings, all of our assessments, and administration has been completed and what time, and the volume that we have infused. Okay, and that's it.